Okay, so stroke warning signs. This is something that you really want to pay attention to. If a person has sudden numbness or weakness of the face, arm, leg, or especially one side of the body, that's a definite warning sign. If they have sudden confusion or trouble speaking or understanding, it's as if they just kind of are like a blackout, but they're still awake. Sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness or loss of balance or coordination, a sudden severe headache with no known cause. These are all stroke warning signs. So what I'd like you to remember is this acronym. It's the first three letters of stroke, STR. If you think that someone's having a stroke, I would like you to remember to ask them to smile. If they're able to smile and both sides of their face can lift at the same amount of time, that's kind of a good sign. If one side of the face doesn't seem to be able to smile as much as the other, it's drooping, or they're unable to smile, then that's a big warning sign there. Okay, the next thing that I want you to ask them to do is the T, is ask them to stick out their tongue and move it around. If they can stick out their tongue and move it around with no problems, that's a good sign. If they have problems with that, that's a definite warning sign. The final thing that I'd like you to remember is the R. And so that's raising the arms. Ask them to raise one arm, then ask them to raise the other arm. If they can coordinate both arms and there's no problem, again, that's a good sign. So the sign that it wouldn't be a stroke would be if they can smile, both sides of their face can raise at the same time, no problem. They can move their tongue around and they can lower and raise both arms in a very coordinated manner. Most people know they should seek emergency medical help immediately if they are having symptoms of a heart attack, but the average stroke patient waits more than 12 hours before going to a hospital emergency department, losing precious time that could be critical to treatment. So the reason why I think it's really important, really important for you to know about what are the warning signs of stroke and, the STR test that I asked you to give them is we're going to find out that the medicine for the stroke has to be administered, if it's an ischemic stroke, has to be administered within 3 hours, but you need to get them, you need an hour at the hospital just for them to kind of evaluate, is this a hemorrhage or is this an ischemic stroke? Okay, so here, new treatments can massively help recovery, but they must get treatment within 60 minutes. Okay, so you have to get them into the, into the hospital within 60 minutes, okay, because you've got a window of about 3 hours, but they really have to do quite an evaluation and make sure that they give them the right medicine. Okay, so the most common kind of stroke, an ischemic stroke, can be treated with a drug that dissolves the clots, blocking the blood flow. The window of opportunity to start treating stroke patients is 3 hours, but a person needs to be at the hospital within 60 minutes of having a stroke to be evaluated and receive the treatment. So if you think it's a stroke, do not waste time. Just get them right to the hospital.